Hi, my name is Dr. Jerry Rolfe, and I'm a chiropractor licensed in the state of California. I've been doing weight loss and health coaching for a number of years, and I do a lot of remote telehealth work with folks and patients that I had in California. I am now in Texas. So when you're doing weight loss coaching, it can be frustrating trying to look at somebody's logs if they're filling out one of those little booklets with a program and you're not there to be able to see it. And a lot of us now are working from home, doing more remote work with folks, and that's really where the client health tracker came from. So yeah, I'm still in practice. You can see me in scrubs. At the end of the day, we wanted to make something that made it very easy for you to work remotely with patients just like I do. Whether you're a health wellness coach, if you're a physician, a doctor, a chiropractor, a med spa owner, when you're doing remote work with folks for weight loss and nutrition coaching, an app is crucial for that. And that's where the Client Health Tracker was born. Earlier this year, I developed the Client Health Tracker from scratch. This is not a white label product. This is not somebody else's creation. This is something that I created from scratch and designed to meet the needs of actual health coaches who are in the field today. Done by me as a doctor, for the doctors, for the health coaches. So I understand the pain, working with somebody who is not getting the results that they want to and being able to do a deep dive into that. I realized that when I was reviewing even logs that I could see the manuals for, I was spending 2 to 3 hours a month looking at a patient's logs and figuring out what kind of coaching that they needed. So the Client Health Tracker was designed to solve that issue and really free up a lot of time. Instead of 2 to 3 hours on a monthly basis now, I spend 10 to 15 minutes per month per client or patient reviewing their information because the Client Health Tracker literally does 90% of the work for us. It is HIPAA compliant. It was designed for the medical field, but it's great for the home health and wellness coaches. And I want to dive in and I'm going to show you exactly how this works. So let me go ahead and share the screen with you and show you exactly what we're doing here. All right, so this is the Client Health Tracker. Right off the bat, you can just gonna run through the website, but let's go ahead and log in and show you exactly what we get to see. We have three different login levels. We have the clinic owner or administrator. We have a coach login and a client or patient login. What I am showing you right now is the clinic owner login, what most of you will be signing up for to manage your patients, your coaches. If you've got a number of health coaches, this is wonderful because we even have an unlimited plan where you can have an unlimited number of coaches and unlimited number of clients and patients. So let's dive in and show you exactly what we can do here. Notice at the bottom of the screen here, we're always getting a prompt to be able to install this locally. Yes, it's HIPAA compliant and it's secure, but we can run it right here through the URL of the window of the browser, or you can install it locally for even more security. This is also available on mobile, which patients tend to love because they're obviously taking snapshots of their food. But when patients are looking at food, everybody's doing photos of macros and taking pictures of the food. It's evaluating the proteins, the fats, and the carbs, and that's great, but that only goes so far. If I truly want long-term results with my clients, I need to know more about the micronutrients. So we're tracking micronutrients. We are tracking the macros for sure, the calories like everybody else is, but going way beyond that, we're tracking dietary preferences. If somebody's vegan, vegetarian, halal, pescatarian, you name it, there's a lot of preset choices for those. We are tracking food allergies. If somebody has an dairy allergy like myself and they upload a food process, a picture that looks like something that they shouldn't be eating, the AI is going to flag that and coach accordingly. We are also tracking health conditions. So let me show you what that all looks like. So if someone has, say, diverticulitis or diabetes or PCOS or fibromyalgia, and they're consuming foods that are aggravating that condition, we can coach to it. And you don't have to worry about it. The AI will literally do this for you. So clinic dashboard here, we can see the coaches that we've got going on, recent activity with our patients. And so let's take a look and see what we have as far as a quick snapshot for the coaches. Three coaches here in this demo clinic, and Tammy, Kristen, and John. You can get in here and you can update their passwords. If you're changing staff and a coach goes away for whatever reason, their patients that you had assigned to them roll right up to you as the clinic owner, so you're not losing any data. It is very easy to simply add a coach in here. And then we get a snapshot of all the clients that are assigned to this clinic at the moment. So right off the bat, we can see the number of clients that are going on in this clinic. And notice over here, we see these flashing red buttons showing you someone like Chuck has not checked in for a number of days. In fact, it's been several weeks since Chuck has checked in. And so we're getting that flashing red button showing the last time that Chuck actually did his daily check-in. And then we've got a few clients here that haven't even started their programs. We've entered them in the system, but they haven't done a daily check-in yet. So let me show you what this all really looks like. Going into Bill, we're going to use him as the demo patient today. You can see we're looking at your demographics, certainly your gender, age, height, weight, activity levels, the goals, why are they working with us? But then again, the dietary preferences, the food allergies. So when you come right into update, if you can change these at any time. But we've got a good list of existing dietary preferences to choose from. You can enter specific food allergies. It's just click save and add that right to your patient or client. And health conditions was a big thing that medical doctors asked us for. So we have a nice preset list of anything from cancer to celiac disease. So if you choose any one of these, simply hit add. You can even put the severity. Maybe it's well-controlled medication. And that will change how the AI is customized coaching to your client. So right off the bat, now we are going to coach type 2 diabetes and myasthenia gravis for Bill. And it's that easy to add it. If your patient or client has a condition that is not in that preset list, you can add your own. Simply hit add custom condition, type it in here, and immediately our AI is going to go grab the evidence-based research for that condition and start coaching to it accordingly. You don't have to do the work. The AI is doing the work for us. But the beautiful thing for us are the programs. When you're adding a new client, you can assign them to a number of programs or create your own. We have templates for about 10 common programs that are out there, anywhere from Chirathin, Practice Naturals, someone doing GLP-1 injections, Weight Watchers, Ideal Protein, Optavia. There's a lot of other programs in here that you can select, and those templates are already done, and the AI will coach to them. And you can tweak those programs if you need to. But if you have something that's unique to you and we don't have a template for it, you can create from scratch right off the bat. So immediately you can enter the name of your program, choose the frequency of check-ins you want from your patients, program goals, any nutrition guidelines, foods you want them to eat, foods you want them to avoid, their food allergies, their dietary preferences. Perhaps you're tracking portion sizes at those meals, supplements you want them to be taking. Many clinics have a weekly focus. Maybe it's sleep this week, compliance when they're getting started, energy the following week, but you can control those at any given time and change them at will. What kind of journaling they're doing, their sleep hours, their movement goals for the day. And then the AI messaging preferences. Because some folks have thick skin, some have thinner skin. So we can change how that messaging goes. Maybe it's gentle encouragement, maybe they need a little more tough love, but you have full control over that. When patients come in here, you can get a snapshot of their check-ins. We'll go choose your coach, and then immediately we get a list of all the coaches assigned to that, clients assigned to that coach. So John, I'm going to stick with Bill here. Let's look at the last 30 days. We're seeing his weight trends, his sleep, his exercise, his mood. And then under nutrition, we're also logging exactly what he's entering for his meals, whether he's typing those in on the desktop or he's or uploading photos or taking photos of his meals with his camera. It doesn't matter. We're tracking all of that. And the AI will coach accordingly, especially if we see patterns of someone always eating the same thing. Moving on over to reports. Again, I'm going to stick with John in that client Bill. Let's look at the last month here for Bill. I love this because this is what Bill as a client is seeing. So if you ever run into those patients who say, Doc, this is just not working. I'm doing everything right. We know sometimes that's accurate and sometimes that's not. And so I want to be able to see exactly what they're seeing and what kind of coaching they get. We're looking at a good overview of the macros that he's doing based on the meals he did today. This is all AI notification. Looking at the last meal that Bill entered, which was August 19th, everything in yellow here is coaching done by the AI based on his check-in. A good summary of the macros for the 3 meals he entered yesterday. We're looking at trends over the last week or month. We are looking at recipes that our AI puts together, recommending foods that Bill can eat based on the program that he's assigned to, which in this case is a GLP-1 support. But the magic for us comes with the micronutrients. Based on what Bill entered on the 20th here, we can see he did well with one micronutrient, and a lot others need some attention based on what he's entered. So we're putting an emphasis on those. Obviously, calcium, magnesium, potassium, he's got some issues with. But we can dive right into these. We see based on the color coding, vitamin B6, and many of these vitamins were seriously missing. So they're all call outs. You click on one, and not only going to say, hey, you need vitamin B6, but Why do you need vitamin B6? What is it doing in the body and why it's important? Where are you going to get that? What food should you be eating to fix that deficiency? And if there are tips like vitamin B6 is involved with over 100 enzyme reactions, works with other B vitamins for energy metabolism. If there are foods they should be avoiding when they're doing those nutrient intakes, all of that is included and all of it is done automatically by the AI, so you don't have to worry about it. Clinics get a quick overview of all of their admin activities. We have HIPAA compliant messaging between coaches. This clinic doesn't have any clients or patients assigned to them because they're assigning them all to the coaches. But in here, if we did have a patient, we would see all of that two-way messaging. We have resources built in here so you can come in and learn about how to use everything, quick checking references if you forgot how to do something, but it's very straightforward. And it literally takes less than 10 minutes to find out exactly where your clinic is at. For a coach, it takes less than 5 minutes to find out where their clients are at. And the beautiful thing about the client login is it takes them less than 5 minutes literally to log the entire day's food, their sleep, their activity levels, their water intake, their mood, all of that good stuff in less than 5 minutes, and they only have to do it once a day. It's very quick, it's very easy to use, and I'm excited to give you a demo. Hop on the link below, get your 7-day trial, or schedule a demo, and let's get you rolling today.